Hey, welcome back to Morning Chill. Let's bring in right now former FDA Commissioner Dr. Scott Gottlieb. Doctor, thank you as always for being with us. I'm wondering what the news out of Oxford yesterday does to the timeline that many doctors and other healthcare officials have been given to be expecting a vaccine by early November.
Well, it could prompt regulators to take a closer look at the clinical trials, certainly the AstraZeneca trial, but also the other ongoing trials. There's two large trials that are pretty far along, one with the Pfizer vaccine, one with Moderna's vaccine. I'll just remind viewers I'm on the board of Pfizer, the company that's developing that vaccine. It's unclear if the side effect that was unmasked in this trial, and the New York Times is reporting that it's transverse myelitis, basically a form of meningitis where the spinal cord becomes inflamed, whether or not that's causally related to the vaccine. And then the other question is if they do determine that it's likely related to the vaccine itself, the other question is it related to the vaccine construct? So this is an adenoviral vector vaccine where you're using basically a virus, a chimpanzee adenovirus, so a virus that causes a normal cold in monkeys. You're using it to deliver a portion of the COVID virus that you want the body to get an immune response to, in this case, what we call the spike protein. So the question is it the adenoviral vector that is causing the side effect, if in fact there is a direct link, or is it the spike protein itself? And if it's the spike protein, then it might be a side effect that you'd be concerned about with other vaccines, so you'd want to take a closer look at them too. But this is all early days. It's speculative right now. We don't even know whether or not there is a relationship between the vaccine and the side effect.
Doctor, I have not spoken, at least in person, to a doctor who believes that vaccines can be delivered safely by early November. Most say it's going to be a late 2020 or more likely a 2021 event. And obviously it's a moving target. I'm just curious where we are in September. We're coming up to the middle of September. What does the timeline look like to you?
I think it's unlikely that we're going to have vaccines, certainly for the general population this year. I think the idea that you can go to your doctor or go to a vaccine distribution site and get vaccinated for COVID for the general public, that's a 2021 event. Hopefully the first half of 2021, maybe the first quarter of 2021, but it is going to happen next year, not this year. I think in a best case, what you could see towards the end of this year, and I don't think it's going to happen in October and probably not November as well, but perhaps in November, is a staged entry where you get an emergency use authorization where the FDA provides access to certain high-risk populations, either because of the way people work, where they work, so think of healthcare providers, or people who are at a unique risk of a bad outcome. So think of older people, people who might be in a nursing home. I think it's unlikely we get data in October. It's possible if everything goes right, you could get data towards the end of October. But getting the data and getting the FDA to issue an emergency use authorization are two very different events. And I think it's very unlikely we would see an EUA, an emergency use authorization, at any point in early November. I think at best case, it's a late November event, maybe December. I know Tony Fauci has also said perhaps towards the end of this year. I think that's probably a good base case.
Dr. Gottlieb, the American Academy of Pediatrics opened some eyes yesterday when it announced there had been 500,000, 500,000 cases of COVID-19 in children. That represents about 10% of the total number of cases in this country. What does that number tell you, especially as we now send many kids, not all, a lot of remote learning, of course, but we send many kids back into schools. What does that number tell you?
Well, it tells me, number one, the virus has become epidemic in children, and so we should be taking steps to try to protect children. In certain cases, we are. In certain cases, we aren't. I think some schools are doing a good job implementing measures. When you look across the data and you look at the outcomes in kids, there is some reason to be reassured by it. There was a study out yesterday in the Journal of the American Medical Association that basically looked at hospitalizations, rates of intubation, rates of ICU admission, and said that the rates associated with COVID in kids is proportional to what we see in flu. And that's not trivial. Kids have bad outcomes from flu every year, and we know that. But the rate of bad outcomes with COVID doesn't appear to be higher than flu. And so that could be sort of a base case of what the experience is going to be. On the flip side of that, the CDC just reported on the multi-system inflammatory syndrome in children, this sort of post-viral syndrome we're seeing in kids that seems to be an immune-mediated post-viral syndrome. And they just reported on 792 cases. And so the number has gone up. And so that's a cause for concern. So I think the data's mixed, but on the whole, we're not seeing the kinds of high rates of bad outcomes that we certainly see in older people associated with this virus in kids.
As we look at the trajectory of this disease, you've come on over the last several months and others and said you do expect some form of a second wave in the fall and the winter as it coincides with flu season as well. Is that still where you are now as we turn into fall? Do you believe that this is going to come back in many parts of the country?
I think that has to be our expectation. If it doesn't, that would be a surprise, and it obviously would be good news. We've been in this position before when the cases came down after New York. Everyone thought it was over and COVID wasn't coming back. We sort of bottomed out at 20,000 cases a day, and then we had the epidemic in the South. There's a lot of parts of the country that have been largely untouched by this virus, where the virus is going to want to spread. And as we enter into the fall season, people go back indoors, schools restart, colleges have restarted, and those are going to be focal points of spread. There's a real risk that we see sort of a third wave, a third bounce, if you will, in cases as we head into the winter season. Remember, coronaviruses are respiratory pathogens that typically spread in the wintertime. You typically don't see them in the summer. And so this is going to want to spread in the fall and the winter season. And so I think we do face a lot of risk. We need to continue to be vigilant. I know people are exhausted by what we've been going through, but this is probably the riskiest point right now that we're entering.
The number that we're at 190,000, I remember when it was such a massive story when it was 100,000 dead, and now we're edging toward 200,000 dead. At the rate we are going now, from the directions that are being given from leadership to the way this country is operating in terms of this virus, is that number going to go down or is it going to consistently go up?
Well, it's certainly going to go up. I mean, we're going to end up tragically somewhere between 200,000, probably 300,000 deaths by the end of this year. I think the IHME model, which predicted over 400,000 deaths last week, is wrong. I think it's going to be hard to get to that number. Fortunately, but it's definitely going to be above 200,000 by the end of the year, and somewhere between 200 and 300, and hopefully not closer to 300,000. We're doing a much better job of preserving life. In-hospital mortality has been cut substantially, so the rate of death associated with this virus is going to go down as a proportion of the total infections that we see. But there's still going to be a lot of people who are vulnerable and succumb to this virus that we're not going to be able to rescue in the hospital.
Hopefully, Mike Barnicle is with us and has a question for you. Mike?
Doctor, I can't imagine a group of Americans who are more filled with fear and anxiety over the virus than young parents about to make the decision of whether to send their child to preschool, kindergarten, or first grade. What would you tell them?
Well, the first thing, and I just sent my kids back to school, in-class learning here in Connecticut. I think the first thing to look at is what the local prevalence of infection is. And, you know, if the level of infection in your community is low, it's going to be a safer environment to send kids back to school. I think when kids go back to school, it's prudent for the schools to take certain precautions, mask wearing, potting of the kids, trying to bias teaching towards outside the classroom versus inside. If you can hold classes outside. Be very mindful around lunch. If you're going to be delivering food in the school, that's a point where you can have mixing of kids. So the more you can keep kids sort of separated in discrete social groups and not have them intermingling with a lot of other children, that's going to reduce risk. We need to think of risk as cumulative. And so if you're going to be doing certain things that are going to increase your risk, look for other places where you can lower your risk, because your risk of contracting this over the course of a day is cumulative. And if you shouldn't say, well, I'm doing this is high risk, so I'll just give up on all the other stuff. No, that's actually the opposite of the way you should think. You should think that if I'm going to be taking certain steps that are risky because they're important to me, then the other places where I might have taken some risk, try to reduce those risks.
Dr. Scott Gottlieb, thank you so much. And
thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.